Dear future doctors, welcome to Pocket Mbbs, where medicine fits in your pockets. Now let's study. Today's topic is Gestational Trophoblastic Tumor. It is also called Hydatidiform Mole or molar pregnancy, in which there are four types: partial mole, complete mole, invasive mole, and choriocarcinoma. Hydatidiform mole gross is fluid-filled grapes-like vesicles in which appears as a bunch of grapes. In microscopy, hydrophic villi is lined by cytotrophoblast, mononuclear, and syncytotrophoblast, multinucleated giant cells. What is a complete mole? When an empty ovum fuses with the sperm and leads to the formation of a zygote in which there is only one chromosome, one set of chromosomes, 23 numbers. So the paternal chromosome undergo differentiation and form 2n or 46 chromosome. The duplication of paternal chromosome, then the whole genome of the zygote is derived from the paternal origin. So the placenta is neoplastic, fetal parts is absent, and choriocarcinoma risk is increased. It is most common in 90% cases and in which P57 is absent, which is a tumor marker. Now the gross features of complete mole is enlarged uterus and characteristically filled with grapes-like vesicles. Vesicles contain clear watery fluids. Microscopic features are large, rounded, edematous and acellular villi, cytotrophoblast and syncytotrophoblast. Clinical features of complete mole are abdominal swelling due to rapid increase in uterine size, mistaken for normal pregnancy. Rapid increase is disproportionate to the stage of pregnancy. Vaginal bleeding present, passage of grape-like masses per vaginum present, and nausea vomiting is present. We diagnose this condition due to high level of β-hCG in the blood. Now, partial mole is formed by when a normal ovum fuses with more than one sperms. It leads to a zygote formation which has more number of chromosomes than 46, in which one ovum fuses with two sperms lead to formation of 3n and 69 chromosomes with XXY or X genetic phenotypes. Now here the fetal part is vacant because both male and female gametes contribute in the zygote formation. So the gross is uterus is smaller than expected and contains some cystic villi. Microscopically, some villi show edematous change while others are normal or even fibrotic. Clinical features are these fetus usually die after 10 weeks of gestation. It could not complete the pregnancy. Now, if we search the invasive mole. Invasive mole is in which the molar villi is present. When complete or partial mole penetrates or perforates the uterine wall, it enters into the veins of myometrium that leads to the spread to distant site, mostly lung, which turns into an invasive mole because it invades other organs. And it occurs about 50% of complete mole and rarely in partial mole cases. Now the causes are hemorrhages and uterine proliferation. Gross features of invasive mole are invasion of molar tissue into uterine wall. Microscopically, lesion is benign and identical to the classical mole but has a potential for hemorrhage. Clinical features are irregular uterine bleeding, enlargement, vaginal bleeding, spread to local area into the peritoneum and blood vessels, and via blood to lungs and brains. What is choriocarcinoma? Choriocarcinoma is a highly malignant and widely metastasizing tumor of trophoblast. Grossly, the tumor appears a hemorrhagic, soft and fleshy mass in which no villi formation is seen. Microscopy is the absence of identifiable villi. Massive and columns are highly anaplastic cells and bizarre cytotrophoblast and syncytotrophoblast cells seen, which are intermixed. Invariable presence of hemorrhages and necrosis. Invasion of underlying myometrium and other structure, blood vessels and lymphatics. Clinical features are vaginal bleeding following a normal or abnormal pregnancy, metastasis into brain and lungs. It diagnosed by high level of β-hCG in blood. Spread of choriocarcinoma by hematogenous spread to lungs, vagina, brain, liver and kidney. Now the treatment for choriocarcinoma is chemotherapy. Here we can see the histology of Hydatidiform Mole, in which we see hydropic villus core, cytotrophoblast, syncytotrophoblast and trophoblastic proliferation. Now that's all for today's videos. Thank you. Follow for more such videos and do like, share and subscribe to my channel.